We would have Dr. Laura Chiavaroli from the University of Toronto. And Laura is assistant professor of nutritional science at the Faculty of Medicine there. We have done very interesting works in design clinical trial as well as the digital to help patients with diabetes during the research, during managing their sugar level, of sources, and caloric displacement.
Great, thank you, Simin. Thanks everyone. It's great to be here today to talk to you about a culmination of a lot of work that probably started over 10 years ago when I was doing this work on the side of my desk as just some fun extra stuff during my PhD, and then continued on during my postdoc. So a lot of people to acknowledge in how this work came about. But in kind of talking about carbohydrates, we're going to zone down a little bit to talk specifically about sugars, but also reflecting on the importance of the quality of the foods in which these sugars are coming from. So these are my disclosures. So we constantly and continuously face public messaging against consuming carbohydrates, but particularly when it comes to sugars. And that includes fruit, which gets some negative messaging in articles and in the public sphere. And then to the extent that health service documents have even reframed the way we used to call fruits and vegetables to vegetables and fruit, again, taking away the focus on of fruit. And as Joanne mentioned, it is water and sugar, but there's a lot more to it than just that, but we'll get into that. And then there's also a specific focus on fructose, as it is an unregulated substrate for de novo lipogenesis. So if we look at the guidelines, what they say about sugars, they recommend reducing energy intake from free and added sugars to below 5 or 10%. And then the source of the evidence behind these guidelines are largely based on sugar-sweetened beverages. So now when we get into the actual evidence, this is where we're going to get into a few questions, which are going to be answered through a series of systematic reviews and meta-analyses that we've conducted to get both at the question around energy and the contribution of energy from these sources of sugars, and then getting into the food form. So starting with getting into energy, and we've seen this image yesterday when we're looking at the hierarchy of evidence and evidence-based medicine. So our systematic reviews and meta-analyses included those including randomized control trials, as well as a series on those that are on prospective cohort studies. So I'll be presenting the evidence from both of those series. So this is the series that was done on looking at the randomized control trials. So we did individual systematic reviews and meta-analyses for each of the cardiometabolic risk factors listed here. And so the first thing to importantly note is when we looked at the randomized control trials, we categorized them based on the way in which the intervention and control was being given. So if it was in a substitution setting where people that were randomized to the intervention were given a quantity of the food source or the source of the sugar equivalent to what something was given on the control, then it was considered a substitution because you have energy matched. And that contrasts studies where the intervention was given that source of sugar as the source of excess calories, and the control was just carrying on a status quo. So making that differential between the studies to start off. So if we look at the evidence from the studies which were categorized as substitution, so this plot here has each of the individual meta-analyses here, so categorized by the outcome, and then you've got the red dot is the overall pooled effect of each of the individual meta-analyses. So what we can see here is that when it comes to the substitution where you've got energy matching, you're not seeing any harm, but you are seeing some benefit when it comes to a couple of the outcomes like glycemic control and blood pressure. However, when you look at the addition trials, and this is where you're given that source of sugar as excess calories, that's where you see the harm showing. So anything that's highlighted in red is statistically significant. So from body weight to lipids to glycemic control, uric acid, and NAFLD. So going on to the cohort studies, and these are the incident cardiometabolic diseases that we explored. And again, similar plot where you've got each of the individual meta-analyses listed by the outcome. So there were a couple signals for where there's benefit when it comes to sources of sucrose. And then there are a couple instances where you're seeing some harm. And then when you further explore the areas with harm, you're seeing a nonlinear association. So there is harm coming at the higher doses of intake. And that kind of aligns with some of the RCTs. Again, when it's coming as excess calories, it's usually coming as a higher source of energy. So now the slightly more recent series of systematic reviews of meta-analyses where we get into the evidence on the looking at food form. So going a step beyond just a source of energy. Starting with the randomized controlled trials. Again, this is the series that we did on a variety of the outcomes. I'm going to walk you through the most recent one just to kind of give you a bit more of an inside scoop on the evidence. So we'll start with we'll look into the systematic review meta-analysis that was done on body weight, and this we published just last year. So this was a very large systematic review meta-analyses. We had over 10,000 reports identified in our search, which gave us 169 identified studies, which provided 255 trial comparisons in over 10,000 people. These are the trial characteristics to give you a sense of what the population is and what are the numbers from this meta-analysis. So we have over 126 studies that were in the substitution analysis, 104 in the addition, and then fewer in the other two categories where we categorize the studies by energy. So a subtraction trial basically is if you recruit people, for example, that drink sugar-sweetened beverages, and one group continues on with sugar-sweetened beverages and one is given a diet pop or water, then you're getting that reduction or that subtraction in energy. And then ad libitum, where they're just being given the diet advice freely. In terms of the health status, the population, they were generally middle-aged adults with or without obesity who have or were at risk for cardiometabolic diseases. And then the follow-up duration was about 6 weeks in the substitution and addition trials, and then a little bit longer, 18 weeks for subtraction and 11 weeks for the ad libitum trials. And the box at the bottom here, not that I expect you to read it, but is just highlighting all the different sources, the food sources that we had from all of the studies that were included. So this gave us the ability to really look at the differences between studies that were looking at sugars coming from different food forms. So you can see we've got SSB, so sugar sweetened beverage studies. You've got sweetened dairy alternatives, 100% fruit juice, etc. So this allows us to further explore and look at the differences by food source. So this is a super plot. Sorry, it's a lot going on here. But to read it, these you've got them categorized first by energy. So these are all the substitution studies, and then broken down by food source. And then that's the total for the meta-analysis. And this is the addition trials, all the food sources, subtraction, ad libitum. Hopefully you're following. Okay, so if you want to look at the overall effect of the substitution studies, irrespective of the food source, so when energy is being matched, there is no signal for any effect. And this mirrors what we saw when we did the series probably about 5 to 10 years ago, looking at it from the perspective of energy. So following along what the evidence was before. And then again, similarly, when you look at the overall effect, when we're talking about the addition studies as a source of excess calories, that's where you're seeing the signal for harm. And then the subtraction trials, as hypothesized, you would see a reduction. And so you're seeing a reduction in body weight here. And then ad libitum, you see no effect. Okay, so that kind of mirrors what we've already seen in the previous studies. But then when we looked for an interaction by food source, so what that's doing is saying, when I look at the kind of individual meta-analyses of all the pooled analyses for individual food sources, do these differ? And so it was statistically significant across all of them. So the food source matters. So interpreting what the pooled effect means may not necessarily be correct. You should look at it by the different type of food source. So instead of using this to show you what all the effects are by the individual food sources, I'm going to present it a little bit differently and hopefully a little bit more easily to digest. So we start by looking at some of the food sources where there's a signal for some harm. So this is the sugar sweetened beverages and some of the other ones. So this is in addition studies where you're seeing that harm, you're seeing that intake of excess energy. We saw that there was an increase in markers of adiposity in the studies where they're looking at sugar sweetened beverages being consumed, and similarly for fruit drinks. and mixed sources with SSBs. So those are studies where they were given SSBs and some other type of source of sugar, all leading to increases in adiposity. And these are the magnitudes to kind of get a sense of how much body weight was increasing in the intervention arm where they were given that food source of sugar. And then the opposite, when you look at the subtraction studies, that's where you see a reduction in measures of adiposity, and this is coming from the food sources where they were mixed sources with SSBs. Again, just remember the subtraction, there were much fewer trials here, so we're not looking at too many different types of food sources, but that's where you're seeing the benefit. Okay, and then looking at where we see some benefit happening here in the substitution study. So even when you're having energy matched conditions, fruit showed a reduction in adiposity. And then in the addition trials where their foods are being consumed on top of a diet, you're seeing benefit of dried fruit, honey, fruit at less than 10% of energy, and 100% fruit juice at less than 10% of energy. And then these are to give you a sense of the magnitudes of what you're seeing with the intervention being given as a source of excess energy, or at least prescribed as a source of excess energy for these different types of food sources. Okay, so now to put this specific adiposity meta-analysis into context with the rest of the meta-analyses that were done as part of this series. So again, just to remind you, these are all of the outcomes that we've looked at. So to present all of this data, I've put together this table here. So these are all the individual meta-analyses, and the N in bracket is where you can see the number of trial comparisons that are included. So you can see it's quite a large body of work that we were able to pull together. And then along the top here, I have all the different categorizations of the studies by energy control. So what we saw fairly consistently in all of these meta-analyses across all of the outcomes is this signal for harm coming from studies that are looking at the consumption of sugar-sweetened beverages, which is no surprise to anybody in this room. And then we also saw signals for harm coming from mostly the studies where you've got sugar-sweetened beverages plus another source of sugar. There's also a couple small other ones, but the main consistent finding here is the SSBs and the SSBs plus another source. Now looking at the green, where we're talking about where we saw benefit, fairly consistent across a lot of the outcomes for fruit, whether it's in substitution or addition form. And then also 100% fruit juice, we're seeing a lot of signals for benefit here as well. There's a couple other foods that kind of popped up. I mentioned for adiposity, you had the dried fruit, the honey, and then for inflammation, we actually saw from sweetened soy beverages and chocolate. So now taking a look at the cohort studies and how those results compare. Again, these are all the different incident cardiometabolic diseases that were explored, all separate meta-analyses. And so to present this one, we created a heat map. So at the top this time, you've got all of the incident cardiometabolic diseases, and then along the rows, you have all the different food sources. So to read this one, when you see red, that's a signal for harm. When you see green, that's a signal for benefit or the association. And the more intense the color, the stronger the magnitude or the stronger the signal. So when you are looking and picking out all the red, you're seeing the signal for harm is very consistent for sugar-sweetened beverages, a little bit for the fruit drinks and confectionery. And then when it comes to where you're seeing green for benefit, that signal that we saw with the randomized control trials for fruits is very consistent here. Some that you see across for fruit juice, and then some of the other foods that we see here, which we didn't maybe have as much evidence for in the randomized control trial, is whole grain breakfast cereals, yogurt. You also see some ice cream here, and chocolate is green all the way across the bottom. So that's the summary of all the meta-analyses across the prospective cohort studies. So now if we kind of take these results and you reflect on how this can move forward when we talk about sugar reduction strategies, there can be some intended consequences and unintended consequences when we say to reduce sugar. So I'll go through a couple examples using some food. So when it comes to sugar sweetened beverages, let's say you have your can of pop and here's your nutrition facts table. So there's about 140 calories and 39 grams of added sugar. Okay, so if we're going to do a sugar reduction strategy, we create a sugar-free pop or a non-caloric artificially sweetened pop, for example, and you have that reduction in energy going down to 0 and 0 added sugar. So in this context, you can easily take the sugar out, put some type of artificial sweetener in, and you get that caloric reduction, which according to the evidence we just finished talking about, would hopefully have that benefit of removing the energy and removing potentially that harm. However, that is not necessarily the case when it comes to whole foods or to more solid foods. So if we take the example of a cereal that went from being its normal frosted flake cereal to all of a sudden being a reduced sugar cereal, and we look at the nutrition tables, I just pulled out a couple things here. The calories don't change in this context, although the sugars went down a little bit as they tried to reduce the sugar from it. But interestingly, a lot of times when they take the sugar out, you got to put something back in, right? Something's got to make up the total weight of this product. And a lot of time that's going to be refined starch. When you replace sugars, a lot of the times you're going to end up with a higher glycemic index food. So not necessarily something that is a better product. And then if you take it a step further and look at kind of the unfrosted version of the cereal, again, there is lower sugar, but no difference in calories and a high glycemic index product. So these kind of strategy to reduce sugar may not necessarily have the benefit that we are hoping from reducing sugar in the diet. Now let's take a look at one other example. So we're taking just our unfrosted cornflakes here and compare it to an all bran buds with psyllium cereal. And so in this case, if you were to just pick up these two cereal boxes off of the shelf and you just look at the sugars blindly at nothing else, you might select the cornflakes because there's only 3 grams of sugar versus the 8 grams of sugar that's in your all bran buds with psyllium. Okay, but if we take a step further and look at something else, look at some other parameters of this product, there is a slight difference in energy per serving. You're also seeing quite a big difference in the glycemic index, a high glycemic index food versus a low glycemic index food. And then one step farther is the fact that the all bran buds with psyllium has the psyllium in it, the added fiber, which also has a health claim for cholesterol reduction. So on multiple levels, this may be a healthier product if you are going to the grocery store to buy cereal. And then just one other example I'll give as something to just reflect on is if you're choosing a product based on sugars alone, if you take just milk versus a plant-based milk, here we're using soy as a suitable equivalent. The sugar content, the added sugar content would be obviously higher in the sweetened soy milk, yet the soy milk, because it has soy, has a health claim for a cholesterol reduction. So if you're interested in potentially trying a plant-based milk, if the sugar content alone is discouraging you, you may want to think about some other parameters of it as a potentially healthy choice to have on occasion. So if we sit back and take a look at the global burden of disease study to explore the top 10 leading risk factors for disability-adjusted life years, here we've specifically taken out the data for Western Europe to make it relevant to where we are. The only 2 dietary risk factors in the top 10 leading risk factors for disability adjusted life years are low fruit and low whole grains. And then if you look at of the dietary factors, the top 10, you can see in green, these are foods that we are low in. And then SSBs is there as number 14 at the bottom. So the main message here, which is what the global burden of disease study is that if we're focusing so much on these negative nutrients, we may not have as much as an impact if instead we were to choose select or focusing more of our attention on increasing uptake of healthier foods that have healthier properties like fruit and whole grains. So overall, in conclusion, the effect of the series that we did on the fructose containing sugars on various cardiometabolic outcomes, this appears really much to be mediated by energy control. So if it's coming in as a source of excess calories, and by food source. So the food matrix, the quality of the food does matter. So the evidence suggests that policy and guideline makers should continue to consider the role of energy and food source when it comes to consumption of sugars for the prevention and management of cardiometabolic diseases, and that targeting sugars as a source of excess calories is still an important strategy. And then when it comes to beverages, that replacement, taking out that sugar and putting in something else, can have the intended consequence of bringing that calorie level down. However, when it comes to solid foods, we really need to be considering a little bit better about how we're going to be making this sugar reduction strategy, because it may have the unintended consequence of having a product that may not necessarily be healthier. And bottom line is you can't choose a product based on sugar level. So I think with that, I would have on this slide everybody who was part of these meta-analyses. So just to acknowledge a very large team of people that have been working on this for the past 10 years. And thank you for your attention.